What's up, Warriors? Hey there, Leland Holgate, and I am the founder and CEO here at the Willful Warrior, combat veteran, and now studying to be a neuropsychologist. And I just wanted to give you guys some detailed instructions so that you can heighten your breath experience, and also some contraindications so that if anybody's dealing it with any of these situations, that you kind of hold off from the breath for the moment. One big safety tip that I like to highlight at the very beginning is please never do this breath while walking, standing, driving, operating heavy machinery, any of those things. You do in this breath work experience what's called vasoconstriction very temporarily. And that can create some lightheadedness, these really blissful feelings. And of course, you should not be driving at those moments or walking or standing. So please be sitting down in a safe area where if you do topple over, which is okay if you do, just have things around you, pillows, be on your bed, have yourself in a safe space. So that way this becomes a healthy practice versus something that you have to heal from again because you went in to do some breath work and got a little woozy. So one of the big things to keep in mind here is that what we're doing is moving through a couple of different modalities. Inside of ancient breath techniques, they used things like intermittent hypoxia, cyclic hyperventilation, which is where we breathe in and out without those pauses, just continually, which super oxygenates the blood. And it also expels a whole bunch of carbon dioxide, which is very healthy for the body, especially in a temporary or acute state. So what we're doing is we're creating alkalinity. High oxygen, low carbon dioxide creates a base or alkaline level system where bacteria, virus, fungus, mold, all these things cannot exist inside of that alkaline environment. So it's a very, very healthy process for the body, not to mention as you're breathing through this, you're also going to elevate your nitric oxide. And that happens in these pre-nasonous sinus cavities that we have. There's 4 of them. And it gathers that nitric oxide, which is a vasodilator. It opens your arteries and veins, lowers your blood pressure, increases your immunoglobulin, which is that serum that your body uses to create your T cells, your immune cells. You also get mental clarity and focus. So many different things happen inside of the body. It's quite amazing. We've actually got a lot of research coming up that we're doing because there's not much done in this. We know the chemicals and compounds that are created by the body, but we don't really know in what amount, and that's what we're going in to measure. Now, the beautiful piece is we have MS patients that have stopped the progression of their disease and have also shrunk the lesions. So that means cells are actually remyelinating, something that the doctors in the past said was impossible is now happening. And we have the proof from ink scans on MRIs, fMRIs, functional magnetic resonance imaging, all of these different tools that we're using now to really take the science into this new age and modern way. So another thing to keep in mind as you move through this is that you're making a huge biochemical shift. You're lowering your cortisol and adrenaline, which is those stress hormones. And they're not bad. That gets your blood pumping in the morning. But when elevated on a constant basis, it becomes chronic stress to the body, which then creates negative effects, right? It activates your genes in negative ways. And genes don't create disease. Proteins create disease. So it's the way the genes are activated. And what we're going to do is make that biochemical shift, lower your stress hormones, elevate your relaxed and happy hormones, and then all of a sudden these genetic processes start to switch and turn on. So we get a couple of different what are called trophic factors that are produced. And these are molecules that the body uses for cell survival and also creation, so brand new cells. And as you're moving through this, you're going to basically turn on a few specific trophic factors like BDNF, and don't focus on the name. It's just a fancy name for a protein that's found in brain and spinal tissue. So it's effectively how I healed myself from quadriplegia and how many of our people are healing themselves from neurological conditions like Parkinson's. We've also had epic results with diabetics, type 1 and type 2. And mentioned our cancer patients as well are bottoming out their numbers. Tumors are shrinking. So we've got a lot of amazing things that are happening with a lot of our warriors. And Just to cover a few of the contraindications today. One that I seriously suggest you hold back on the breath work is if you're pregnant, at least in the first 5 to 6 weeks. In the first 5 to 6 weeks of pregnancy after conception, the neural tube is forming. So that neural tube is what becomes the baby's brain and then spinal cord. So during the first 5 to 6 weeks, it's important not to do anything that would detach that in any way or prohibit its development. So I hold off if you're pregnant for the first 5 to 6 weeks. After that, you can move into some light breath work with no breath holds. And we can talk about some of those as well. And you guys can always hit me up at thewillfulwarrior@gmail.com with any questions that you have, because I can give you specific modifications for whatever you're dealing with. All right. Another one is extreme mental illness. So schizophrenia. I would suggest speaking to your doctor before moving through this. Though this is epic for mental health, we don't yet have enough research to override that contraindication. So other than that, this is epic for hypertension, hypotension. This completely shifts the gas exchange inside of the body, which helps to normalize everything. So if you're hypocapnic or you have a low level of carbon dioxide, this will help to normalize and create homeostasis. All right. So a couple of the things to keep in mind. This is a warrior's breath, an intentional breath. So it's not the, this is with sound and power. Okay. So with that sound, and notice I'm not struggling. My shoulders aren't lifting except for the natural expansion of my lung cavity and allowing everything to open in the intercostals. So I'm pulling from my belly and I'm inviting the air in and I'm pressing it back out. So don't struggle too much with the sound. The sound just comes from moving the air. And you'll find this beautiful dance of where the breath is continual. And you start to feel that. Ooh, yeah, you get that feeling right away because you're hyper-oxygenating the body, pulling in a lot of oxygen, and then you're lowering the carbon dioxide. So you get what's called vasoconstriction, just temporarily, because carbon dioxide also opens arteries and veins. But for the moment, as we're alkalinizing the body, you're going to get a little tension. You're going to get a little tingles. You might even get lightheaded. I love these feelings because they are signs that you're activating genetic processes inside of the body, that you're making a biochemical shift. You're sending signals to the brain and to the rest of the body. Switch, turn on, create these healthy cocktails. So just move through. I'm going to guide you through each and every time you do a practice with me. I'll be right there with you, reminding you and keeping you on that path so that you can continue to breathe. Keep in mind all of our breaths. We do have advanced breaths that come in and out through the mouth, but we're not focusing on those at the beginning. At the intermediary level, we're just focusing on inhaling through the nose. So I may have you inhale and exhale through the nose, which is the, or I may have you inhale through the nose and sigh it out. This is called cyclic sighing, very soothing to the entire nervous system. All right. And that one sounds like this. I love that feeling so much. So those are the big ones. We also have a double breath that you may move through with me as well. And that one is a short inhale through the nose and then a long inhale through the nose with that sigh at the end. Keeping all the inhales and the exhales even is a key throughout all of these breaths. Notice all of my breaths in and out are even. So I'm stimulating sympathetic nervous system and I'm stimulating parasympathetic nervous system, the activated and relaxed nervous systems. So you're going to do the double breath, which sounds like this. All right, so the short breath primes the diaphragm, primes the belly open, then you're filling all the way up and sighing it out. All right, and at the end of all of these cycles, I'm going to have you hold your breath And that's a very key piece. And I want you to let go of tension, release the mind. If the body clenches up, let it happen. Just be a passenger on the journey within for just that moment. That's the real you taking over. The body starting to create and let go of a lot of old processes, creating new processes. And will also create this chemical cascade that up regulates your anandamide, the bliss chemical, dimethyltryptamine, your spirit molecule, and all of these amazing hormones like oxytocin and dopamine and serotonin. Your endorphins are going to elevate, which are your pain pills, basically. You have a pain pharmacy inside of your body. And when you do this breath, you can activate that pain relief for about 4 to 8 hours once you create these chemicals inside of the body. So I invite you to go all in, let yourself breathe. And if you feel the body trying to stop you, just remember the body and the mind are epic survivalists. They're there for one thing, your continued existence. They do not care about your greatness. Neither of them are wired to give any care about your elevation of consciousness. That's our job. That's where we love the ego and we work with that survival side of things. Thank it for being there and then push past that just a little further so that we can actually experience the greatness within. I hope this helps you with all of your breath work, amazing, amazing journeys and epic adventures. I hope you have the most amazing day, week, month, and year. Make it an amazing life, warriors.